All right, it's October, which means it's Breast Cancer Awareness Month. So I've got some preventive changes that you can make to your diet to help protect yourself from this disease. And really, this is for all cancers in general, of what you can do to improve your diet to prevent cancer. So the first one, exactly, is to increase your fruit and vegetable intake, okay? I know that you've heard it before. I beat my head against the wall telling people to eat their fruits and vegetables, but it's because lots of studies have concluded that women who eat more fruits and vegetables, particularly ones that are rich in beta-carotene, so like the orange and red and greens, reduce the estrogen-negative breast cancer especially, which is harder to treat. So the American Cancer Society recommends eating 2.5 cups of fruits and vegetables every day.
Sounds
so
like
add
a lot,
up those fruits and vegetables.
You could do a smoothie or
if you spread it out throughout the day, you have a piece of fruit as a snack, something like that. It's not hard to get 2.5 cups. Or more. The more the better. All right, how about vitamin D? Early evidence has shown that women with higher levels of vitamin D had a lower chance of getting breast cancer. So the best way is to get a supplement because our food supply is not very high. So you can get your vitamin D checked with your doctor, and I recommend between 1,000 and 5,000 IU depending on your level. So if you get it checked with your doctor, then you can ask, how much should I be taking? Okay?
I like
so that's an easy one. All right, what about soy? There's a lot of controversy, myths about whether soy prevents or promotes breast cancer. So results of a Shanghai study says that eating soy during adolescence and in early life can reduce breast cancer, but it doesn't really have much of an effect consumed later in life. The American Cancer Society says it has no harm in eating soy foods and that a modest amount of soy is safe for breast cancer survivors and the general public and can actually lower risk. But they say don't do soy supplements. So there's a lot of those, soy supplements out there. Those aren't going to be beneficial, the soy isoflavones. Eat the actual soy foods.
And I think a lot of the concern with soy is if it's GMO or not. I think that's where people are forgetting, is to check.
Right. Okay, and last one, reduce your intake of animal protein, specifically of animal protein that's high in saturated fat. So studies are showing that a diet with a lot of red meat and high saturated fat can increase the risk of breast cancer, especially when eaten again in early adulthood. And the reasons are unknown, but it could be because meat eaters generally tend to eat less fruits and vegetables, which brings me back to point number one. So also don't char your meat. If you like it like really crispy or charred on the grill, that actually produces some carcinogens that can be a negative thing.
Wow.
This is a lot of information, Tara.
I know. Well, eat your fruits and veggies. Don't eat too much meat. Get some soy in there. And take a vitamin D supplement.
Just whole foods, sticking to whole
foods. So we can go to the website because I need that information. So it'll be on the website, right?
Yeah, absolutely.